Well, good evening. I'm Ann Keel-Dux. I am delighted to join you tonight as the moderator of the In the Know Town Hall. Thank you for tuning in as we continue our important series on the science of aging. Tonight, we will be talking about maintaining and restoring skin health as we age. As you may know, our skin is the body's largest organ. It is essential to protect our body against germs, regulating body temperature, and receiving sensory stimuli from the outside environment. But it is also prone to many problems, including skin cancer, wrinkles, rashes, and so much more, especially as we age. So what does it take to preserve and manage healthy and beautiful skin as we age? Tonight, our experts are going to share the research breakthroughs that are showing promising results for our patients. We will be discussing prevention and treatment options to maintain and restore skin health, from skin cancer detection and surveillance to skin rejuvenation. Our experts are committed to finding prevention strategies and even potential cures to age-related skin disorders. And we're not just aiming for longer lives. We're striving for longer, healthier, and happier lives as we age. We have an incredible panel to discuss skin health. Please join me in welcoming our panelists. Dr. Ralph Paus is a research professor of dermatology and cutaneous surgery and an endowed Frost Scholar in the Dr. Phillip Frost Department of Dermatology and Cutaneous Surgery. Dr. Strasser Hu is an associate professor of dermatology and cutaneous surgery, the director of the cosmetic division and co-director of skin of color division in the Dr. Phillip Frost Department of Dermatology and Cutaneous Surgery. Dr. Andrew Dorisas, a staff physician and board-certified dermatologist and Mohs surgeon in the Dr. Phillip Frost Department of Dermatology and Cutaneous Surgery. It is truly a world-class group of experts that are speaking with us tonight. I'm very excited about this. Before we get started, let's go over how you can participate in tonight's conversation. In just a few minutes, our panelists will answer the questions you submitted over the last few days. Thank you again for doing that. You will also have the opportunity to submit questions during this program. Please use the Q&A feature at the bottom of your screen. And remember, the questions that you are submitting are anonymous, and we will get to as many of them as we can. Our first question is for both Dr. Hu and Dr. Paus. The question is it possible to reverse skin aging? Let's start with Dr. Hu with the clinical perspective, and then head over to Dr. Paus to talk about the research.
Thank you so much, Anne. That was a super nice introduction. Very, very excited to be joining everyone tonight to speak on our really a passion project, especially an interest of mine. I'm sure that's of Dr. Paus and Dr. Dorisas as well. But let's start talking about aging. I just want to preface our discussion by introducing the concept between chronological versus biological aging. So chronological aging is sort of like the age of our skin in measurement by time. So say if someone is 32 years of age, the chronological age of that person should be 32 on average, based on sort of like, that's a constant number for everyone. On the other hand, biological aging is sort of like how young or how youthful your skin appears to be or how well your skin functions to be. So your biological age can be either younger than your chronological age or a more advanced or mature appearing than your chronological age. And our goal as a society with our obsession with beauty is to have younger biological age than our chronological age. So we want to look younger than our age, but not only that, we want to feel younger than our age. So when we talk about slowing down aging, we're not really reversing chronological age, but we're talking about how to address aspects that influence our biological age. So sort of like what things we can do to reverse or improve the functionality of our skin by talking about factors that such as environmental or climate or lifestyle really changes that make our skin age either faster or slower. So the question is that, yes, we can definitely reverse or even slow down our aging process, especially when we talk about aging of the skin. But at the same time, we want to also tell people that we want to embrace aging. Don't be afraid of aging, and really focus on the functionality of the skin, not just how our skin looks.
Thank you, Dr. Hu. Dr. Paus?
I think we need to distinguish between slowing down aging and rejuvenating skin. And the latter is a really tall order. And if you had asked me this a couple of years ago, do I believe that you can really rejuvenate, biologically rejuvenate human skin? I would have been very skeptical until I got involved in research that shows it is really possible. And then the research that we did was you can transplant a piece of old human skin on a mouse that cannot reject it. And if the mouse is young, this young mouse environment really rejuvenates the skin. It begins to look as if it were out of a sudden 30 years younger than it had been before. So that phenomenon had actually already been published in the 90s, and it was completely ignored. And nobody knew what is the mechanism behind that. And the mechanism is really fascinating. It's a key growth factor that controls your blood vessel formation, that drives the rejuvenation of human skin. And that is really exciting because we finally have one candidate that we can jump on and say, okay, if we target this one growth factor, then we can rejuvenate human skin. There's only one little catch. That growth factor is possibly not always your friend. Tumors use it too, because tumors also want more blood vessels, right? So rejuvenating a complicated organ, a complex organ like the skin, may come with a price. So this is it's not all that easy as it sounds at face value. If you identify really powerful mechanisms to rejuvenate your skin, you may also call in trouble. So that will require extensive further research so that we know what is safe and what can safely be done.
Wonderful. Thank you. Well, I hear positivity there. So I like the yes from Dr. Hu and Dr. Paus. Thank you so much for explaining further on that. So when we talk about the most common signs of aging in skin, wrinkles, gray hair, Dr. Paus, can you talk to that a bit further, please?
Yeah, gray hair is one of the first things you see, right? And it is you can hide it, of course, with hair dyes, but the fascinating thing is that the hair follicle itself, so this little mini organ that makes your hair, on the one hand is fairly aging resistant. You see, for example, in an older guy like me, we get longer hair here in the eyebrows, right? And then in several other parts that we don't talk about here. But you also get gray hair. So the same organ is in fact capable of growing stronger in at least some regions of your body during aging. And at the same time, it ages faster than many other organs. And that's what happens in the so-called pigmentary unit of the hair follicle, where the pigment cells that inject melanin into your hair shafts, they die sooner or later. We don't entirely know why that happens. So oxidative damage is one reason. The environment that they need in this little hair fiber factory to make pigment gets damaged over time, and some neurohormones that your hair follicles need to make in order to produce pigment also are being made less when we age. So the hair graying is fascinating, and to make the whole story even more complex, white hair actually grows faster and sometimes thicker than fully pigmented hair. So why is that, right? So in the same organ, pigmentation decays very rapidly. It starts in your in your late 20s, sometimes in your early 30s in most people. And at the same time, that doesn't make the organ as such incapable of producing a hair fiber. Very fascinating. So there's a disconnect between two biological processes.
Very interesting. Well, I think the fact that you said gray hair is fascinating. It's a new word that we're all going to use when talking about gray hair. Let's bring it up and have some positive impact there. Thank you so much for that. So when we talk about, though, what we can do, there are so many products on the market. There are so many products on the market. I probably say that so many times, and I'm sure you all get these questions when you see your patients as well. How do we know which one is the right one for us? And Dr. Dorisas, can you take this one for us?
Of course. Well, I think dermatology is for sure one of the most engaging discussions to have, and I look forward to everybody's Q&A question submissions. But obviously, we live in a world where we have a plethora of options on the market currently. And when a patient hasn't been really educated on what to look for, it can be a very daunting task. It's influenced a lot now in social media through different channels and magazines and news. And so it's not all the same for every person. The first thing you have to understand is what skin type you have, because whether you have oily skin, combination skin, or dry skin, that can change the type of products that you should be purchasing. But also, geographically speaking, it differs. We live in South Florida in an environment that is usually warm and humid. And so that is very different from somebody who lives up north in Chicago, let's say, during the winter time, where their skin, can actually become drier and require a different type of regimen at the time. So knowing your skin type is important, but then looking beyond that, you have to ask yourself, what are your main goals? Are you trying to treat inflammatory conditions on the skin? Do you have acne-prone skin or rosacea-prone skin? Is it an anti-aging regimen that you're looking for, or is it just perhaps some dark spots that you want to address? And so I think looking at all those different options and answering the questions one at a time can then kind of narrow down your choices. But I will say, for the general public, because I think that every person is unique, and that's one of the main reasons that we have our dermatology visits. I think discussion of skincare is part of that. But the overall premise should always be cleaning your skin with a good cleanser, protecting your skin, which is the number one cause of aging, in fact, as well as many other things, with a good sunscreen that's suitable for your skin, and then a moisturizer. I think those are the three key elements that we can just say that this is kind of the base, and then you can build on those three pillars, whether with anti-aging, like your retinols, and then with all these other ingredients that we have for everything else that we talked about.
Thank you.
Add a few comments to this.
Of course.
So, if the original question was, how do we know what works and what doesn't work for anti-skin aging? Let me answer this in a negative way. So, what is not evidence that a product that claims to do something against skin aging is working is if some social media influencer says it works, or if excellent marketing impresses you. From a medical and scientific point of view, the only thing that really convinces or should convince you is does the company that promotes a product have they presented hard evidence that it really works in human skin? And that is not easy to judge for consumers. And that's what they can also discuss with their dermatologist, what the dermatologist has to recommend. So we all are trained in being critical with these claims, and the consumer should be trained too.
That's a very good point. I think clinically proven ingredients are something that obviously all physicians are aware of. But as Dr. Powell said, just simply stating on social media that, oh, these are clinically proven. Studies are also different. The level of evidence and the type of studies that these companies end up having to do differ. And I think at that level, it really, you have to depend on your dermatologist to have read the studies and kind of looked at the alternative options to make the right choices. It's a very good point.
Wonderful. So do your research, talk to the experts, certainly for that one, because we get bombarded by a lot of different brands on social media, on television, and so on. Thank you for that. And speaking of sunscreen, this question is for Dr. Hu, a new question that just came in. So thank you to all of you who are sending those questions in right now. Outside of sunscreen and having that nice regimen on a daily basis, when you talk about someone who may have limited resources financially, are there procedures that they can undergo to improve the aging process?
Absolutely. That's a great question because we definitely want to keep budget in mind when we recommend office-based procedures. Obviously, as you mentioned, sunscreen is really the pillar of any anti-aging regimen. So beyond sunscreen, good skincare at your own budget. I actually love microneedling as a relatively affordable, economical, budget-friendly, but evidence-based procedure to rejuvenate skin pretty much of all skin type, including people with acne-prone skin, including people of skin of color or sensitive skin. Microneedling is not anything new. It has been around for decades. It's a mechanical resurfacing of the skin that in which we actually kind of like simulate a wound healing process of the superficial layers of the skin through a mechanical pen that creates tiny, tiny channels. And that wound healing process is what we use to harness the power of your own cells that lead to improvement in your collagen production, lead to improved epidermal as well as dermal cell differentiation, cell turnover. And there have been rigorous studies have shown that pretty much all parameters of skin quality, ranging from skin thickness to collagen content to fine lines, as well as how much your skin holds water, what we call transepidermal water loss, improved after microneedling procedure. But keep in mind, microneedling is also being offered at various med spas that you probably have seen on Groupon advertisement. So when I talk about microneedling, I'm speaking about medical grade microneedling, where you know that you're getting a clean procedure. The techniques and the instruments we use are sterilized and a single patient use. So there's really no risk of infection and also at a much more aggressive depth performed by esthetician or other non-certified practitioner elsewhere. So there's definitely a difference between medical grade microneedling versus a commercial grade microneedling. And then additionally, microneedling is also good for targeted concerns such as acne scar, coarse texture, or people with a lot of uneven pigmentation. So that's sort of like my biased opinion on sort of a budget-friendly procedure that can help you to rejuvenate, that does not break your bank.
Thank you. And getting back to sunscreen, I think a lot of us automatically think, okay, we'll put it on our faces, but is that enough? Where should we be applying sunscreen on a daily basis? Because sometimes we may be in our car and feel like we may be getting a tan in our car and not realize it.
Yeah.
So on a daily basis, where do we apply?
That's a great question. I'm definitely a big believer in sunscreen. So any part of your body that's exposed to sunlight, you should be covering it with sunscreen. So particularly not just the face. I tell patients, make sure you put enough sunscreen that covers the skin around your eyebrows, because this is where we catch a tiny basal cell skin cancers, a tiny skin cancer that stems from just a little area we missed sunscreen on from day to day. Make sure you close your eyes and put sunscreen around your eyelid skin. And if you have sensitive eyes, you can get sunscreen specific design for eyelid skin. Make sure to put sunscreen on your ears, especially for men. This is where we see a lot of skin cancers, basal cell, squamous cell carcinoma. And then for women and men, if you're going to be out playing golf, tennis, make sure you use a lip balm containing sunscreen, because skin cancer of the lower lips also happen, and that can be very disfiguring. And then, as you mentioned, for areas on the neck and the décolletage, make sure you put sunscreen on if you're going to be commuting for hours, long hours in the traffic, facing the sun. This is also why I tell patients, leave sunscreen in your car but make sure you change them out regularly so it doesn't expire, because the heat in the car can also produce some damage to the quality or the stability of the sunscreen. Lastly, the back of your hands, very important from driving. We often see patients with a little more advanced signs of aging on their left side just from driving. Accumulation of UV damage do produce a significant difference over time. And then very lastly, I want to say there is evidence, large-based population-based studies showing that daily sunscreen application reduces signs of aging and reduces incidence of skin cancer compared to discretionary use of sunscreen. This is where they study thousands of people, a group of people asked to use sunscreen every day, and another group of people asked to use sunscreen as needed when they feel like the sun is strong, when they're going out. So we know that daily sunscreen does make a difference in both aging and skin health.
And is
I
there a
agree. I
preference
think
on SPF?
So we, as dermatologists, recommend SPF 30 or higher. Beyond that, there's a very minimal difference in the laboratory testing of the sunscreen. But in reality, we never put on enough to achieve labeled SPF. So this is why I'm biased towards higher SPF, even though you may pay a little bit higher premium for higher SPF. So if you want to stick with something that's affordable, make sure you just apply enough. Enough meaning that you should be able to feel the layering of sunscreen, and you should be applying at least one middle finger length of sunscreen to the face. That's a rule of thumb.
And Dr. Dorisas, please continue.
I was just going to say that, from a pragmatic standpoint, I think when you start building a daily habit, whether it's in the morning, before you put on your makeup or right before you leave the house, whatever it is, building a habit will then eventually just become second nature. And so I think when you look at sunscreen use, especially in Florida, it's easy to remind yourself to do it daily because we live in a sun-kissed state. And I think that's a very important way to think about it. And I'll just add to the sunscreens that we think about sun damage coming or aging or whatever it is about coming just from the sun, and yet people who work indoors close to windows, there is direct exposure to UV radiation through that as well as LED lights. So there's a decent amount of evidence showing that blue light can have an effect on both signs of aging and perhaps with free radicals on skin cell damage as well. And so I think building a habit and just doing it daily will eventually be the best choice.
Can I make a
And
comment
Dr.
on building a habit?
Yes,
This
please
this is
do.
this because that's something that most people may not know. So on the one hand, Dr. Ruiz is absolutely right. We should make it a habit to use sunscreen routinely. On the other hand, it's now very well known that even though people know how damaging the sun is not your friend as the skin. We have a habit of overexposing ourselves to the skin. And recent research in mice has given an explanation for why that may be. Mice actually get addicted to UV light. And how could that possibly be? Well, your skin makes the happiness hormone, beta endorphin. And so if the skin gets irradiated by sun, you make more of that. And that's actually why you feel good if you go out in the sun, right? So the sun, in a sense, puts you also into a habit that damages your skin. So that, of course, makes it even more important to follow the advice of Dr. Teresa's.
Thank you. And Dr. Paus, we hear about vitamin D3 as being potentially something positive to put on our skin on a regular basis. Is that true or false?
Yeah, the research on that is the last verdict on that is not really out yet. Whether that really makes that much sense, it probably suffices if you take enough vitamin D orally. But there is good reason to believe that vitamin D application to your skin can be protective against skin cancer. because it inhibits the massive division of cells, the uncontrolled division of cells. So there is good reason to believe why it should work, but I'm not so sure that the studies out there have already shown that external use of vitamin D is really beneficial. Internal application or consumption of enough vitamin D, that clearly is beneficial.
Thank you. We have so many questions coming in. Thank you all so much for continuing to send them in. We have one for Dr. Dorisas. So how safe is phototherapy for vitiligo patients, I believe?
So vitiligo, for people who don't know, is an autoimmune skin condition where the body attacks the cells that can produce pigment or color. And so you're left with white skin, which is completely left unprotected from the external elements such as the sun. And therefore, you have an increased risk for things such as skin cancer. And historically, phototherapy has been one of the mainstay treatments where we do know that with certain UV wavelengths, there is re-stimulation and diminishing of the inflammation at those sites in order for the pigmentation to start reoccurring and getting your color back. And I believe the question is whether or not it's safe to have phototherapy, which is, I guess the exposure to sunlight, but not exactly sunlight, in order to treat it. And so the short answer is we still do use narrowband UVB therapy, which is the type of phototherapy that we utilize in office to try to get the pigmentation back. There have been studies, and there is a small increased risk in the development of both melanoma and non-melanoma skin cancers in those areas. However, depending on the effect of the vitiligo on the person's psyche and self-esteem, it's a small risk that you need to be that we take. Now, these are controlled exposures. They happen 3 times a week for a certain duration of time. And so it's not an unlimited exposure where you would lead to a sunburn or the extent of inflammation that can then kind of increase those numbers and those risks of skin cancers. That being said, when we talk about vitiligo, it's actually one of the most currently researched topics in dermatology in terms of new age treatments. And there are currently approved new therapies for that in the form of creams that may be a little bit more effective than phototherapy. For example, it's a topical JAK inhibitor for those who want to look it up. And then there will be several more coming in the near future, I would say over the next 4 or 5 years to treat vitiligo.
Thank you. And sunscreen is certainly top of mind as we head into summer. So we're pivoting back again. Dr. Hu, when we see sunscreens inside for women, foundation and other products, would you say that that is a good sunscreen, or should we keep our products separate?
I'm definitely very biased because I believe in the application makes a huge difference, because when you apply, like say a foundation with SPF, you're not going to layer that foundation on thick enough to achieve the label SPF. So it gives people a false sense of security. It's just so much easier, so much more peace of mind when you apply sunscreen by itself. And then you can layer on a blush with SPF or a pressed powder bronzer with SPF. Definitely try not to save your time by skipping the SPF and then using a moisturizer with SPF or other products with added SPF, just for the pure reason you're not going to apply enough to achieve labeled SPF. However, on the other hand, the more products with SPF you can incorporate in the morning routine, the better. And interestingly, this is why a lot of times when I treat more mature women in my office, I see their face looking a lot younger than their neck and décolletage, because they have been using SPF with the foundation, with powder over the years. So there are definite advantages for using SPF.
Thank you. And we spoke about vitamin D. What about vitamin C?
Yes, vitamin C is definitely one of my favorite ingredients. In fact, when we look at Dr. Powell's earlier mention about evidence-based research on ingredients and efficacy. So there are only a few topical antioxidants that has a level 1A or 1B evidence. So when we rate the strength or the robustness of a research data, we say there's a level 1A, level 1B, level 2, 3, 4. So the higher the number, less reliability or less robust the data. So when we talk about evidence 1A and 1B, we're referring to ingredients with studies that have even been randomized control trials or studies that have meta-analyses of multiple randomized double-blind control trials. So vitamin C is one of these ingredients that with level 1B or 2A evidence. So there's numerous studies showing that topical L-ascorbic acid or L-ascorbic acid derivatives helps to boost the efficacy of the SPF by working on the reactive oxygen species pathway of your skin. In addition, it neutralizes fights free radicals generated by sun exposure. And then lastly, it helps to promote collagen production because vitamin C is an important cofactor for collagen. So there's a lot of benefits using topical vitamin C, but if you use in the morning with your SPF, you get a little bit boost of your SPF efficacy.
Wonderful news. So we talked in general about reversing skin aging early on in our conversation. Dr. Powell, does that also apply to our hands?
You mean the skin on our hands, or?
Yes, sir.
Yes, of course it does. But as we already heard before, the skin of our hands is particularly UV exposed. And so while you might be using creams that slow the aging process, they at the same time you keep exposing the skin of your hands to UV damage, and that's a balance that most hands lose in the long run, unless we use the habit. I keep coming back to that Dr. Reyes has advised to fall into. Cream, cream, and cream, and then even your hands may do well in the aging process.
And we spoke about climate before, and we live in sunny South Florida, lucky us. And we talk about sometimes not liking the humidity, and other times not so bad. But that warm, humid climate can be good, I'm assuming, versus the cold and dry. Dr. Durices, can you talk about this a bit more and why we should stay here in South Florida, hopefully?
So I guess it's a double-edged sword. You have the one on the one end you have the sun, and on the other hand you have the beautiful weather and humidity. And so I think the easiest way to think about it is if you imagine the skin as a layered brick wall, when all the bricks are intact, that has the optimum health. And so all the water that we have underneath in our skin cells are not able and doesn't escape unnaturally, which is good and keeps the hydration inside. And so when you have cracks in that skin, and you can think of cracks as any type of inflammation, whether it's eczema, it could even be acne or rosacea on the face, or anything in between. You now have water that seeps out, and so that starts making the skin drier. And that's kind of where we start using our humectants and our moisturizers. Now, when you live in a cold environment, those the cold weather itself, but then also the rapid changes from warm to cold, because nobody really stays outside when it's cold. You always kind of go from your warm car to your hot shower, and then back in the snowy weather for a bit. And so all these changes end up damaging that skin barrier more. And so somebody who has dry skin will have much drier skin, and therefore they'll have to moisturize perhaps even twice a day. People who have oily skin tend to have that layer of sebum that they create, that oil that maybe acts a little bit better in terms of keeping the water within. But when they move to a cold environment, that then changes and becomes drier. So we're lucky because we don't have to fight with the environmental factors as much, which makes our lives a little bit easier, I would say. but it doesn't make it 100%. And so people who have these chronic skin conditions still deal with them, whether they're down south or up north. It just differs a bit, I guess, in terms of how frequent they flare, their severity numbers might change a bit, and things like that.
Thank you. So we talked a little bit, Dr. Paus, about clinical trials earlier. Is UHealth participating in any that address autoimmune diseases that attack the skin?
Yeah, but that doesn't really speak to the skin aging problem, right? So we know that diseases that cause chronic skin inflammation will promote a process that's called inflammaging, where inflammation promotes aging. And that's actually a fairly new research frontier. We begin to understand that suppressing chronic inflammation in actually all of our organs um, is a good idea if we want to fight aging, because inflammation has, in general, if it's chronic, an aging promoting effect. So that's probably the link one can see there. So having a effective, in most cases systemic, autoimmune disease therapy will also fight this process of inflammation promoted aging.
Thank you. Appreciate that. So what do you recommend when the skin has GvHD? This is for Dr. Dorisas.
So GvHD stands for graft versus host disease, and we see this in transplant patients, usually bone marrow recipients, and it's a type of pretty significant inflammation that can affect both the skin and the internal GI tract. And so I'm assuming the question is how to select products to treat the skin, because what happens is that skin becomes almost scar-like, where it can become a little bit thickened and damaged. And so I would absolutely recommend absolutely seeing a dermatologist, because there are prescription level medications that we do use to treat these conditions. But then at the same time, the GvHD severity differs wildly. Where you can just use something as simple as a topical steroid agent or a calcineurin inhibitor, but then may even need to progress to systemic agents. But I will say that skin barrier that we talked about earlier is absolutely going to be damaged from the get-go. And so just simple protective techniques are very important. And so the obvious one here is always going to be sun protection, because one of the things, depending on that person's skin color, is going to be darkening of the skin as well. And so you always want to start with a good sun protector. And the second thing is a good moisturizer. We didn't talk a lot about moisturizers and the different types, but when we look at the body, when we look at these thicker cream-based or ointment-based moisturizers for the arms and legs, we actually provided an occlusive layer that is a bit more effective than something such as a butter or a lotion. And I think that's very important for somebody who has GvHD.
And would you extend that to people who have other types of conditions, or even potentially any advice for someone who perhaps has a lot of skin damage?
Well, yes, I think that one thing that we do see over the course of time with aging chronologically is always going to be an increased level of dryness in our skin. Our skin collagen levels start to diminish and our skin becomes a bit thinner. It'll become more susceptible to environmental stimuli, and then it will get drier. And so I do think that everybody should moisturize, especially when the skin gets some form of injury. Something as simple as taking a shower actually dries our skins. If people can just think about when they take a shower and when they're drying themselves, if they look at their legs and their feet and their forearms, they might notice a little bit of dryness and nastiness. And so I think moisturizing after you shower is a very important concept to also employ. But then, of course, as we get older and that dryness level increases, then it should be something that you should absolutely do on a daily basis, if not twice a day. And I do like to tell my patients that for their lower legs, kind of knees down, the thicker the moisturizer that they're willing to use, the better. There are moisturizers that have, simple extra elements like colloidal oats, which have an anti-inflammatory property that can feel pretty soothing to the skin as well. And then their forums also. I think that's something that you should kind of think about staying in the cream category.
Thank you. So heading back up to our faces, those cranky bags under our eyes. Dr. Hu, any recommendations on how to get rid of them?
That's such a common question. Number one, I really want to say we can't really get rid of any eye bags because I think we all have eye bags. Eye bags is really like a sign of life being lived, well lived. Eye bags form for a few different reasons. So very quickly, it could be hereditary. A lot of times look at your parents, look at your family members who can run the family. So usually that's more of early onset. So you have a little bit eye bag, like puffiness under an eye, have a little bit deep tear trough. Eye bags can also reflect transient fluctuations from water retention. Say if you have not slept well, if you have dehydrated or had like a really salty meal the night before, or you have any issue with your hormones, like thyroid issues, you can have eye bags. And then lastly, a natural sign of aging. So our skin around the eyes are very delicate. Or blink our eyes about, I think it was like 15,000 times a day. So there's a lot of mechanical stress over time. And then additionally, the oil glands around the eyes are a little bit less active than the oil glands on the rest of our face, hence why we age a little bit faster around our eyes. And then with aging, that skin gets a little bit saggy, and then we have natural fat herniation underlying the skin, so to make it look puffy. So I would say I usually recommend definitely start using an eye cream when you're noticing a little bit of skin crepiness around the eyes. Secondly, really watch for your sleep pattern. Sleep hygiene is very important. Hydration is also very important to eliminate the transient issues that can exacerbate eye bags. If you have a seasonal allergy, treat that. That will also help reducing that fluctuation. And then lastly, if whatever you're doing, you have been consistent and still seeing the kind of tired puffiness or dark under eye circle, then for sure we can do an in-office consultation. We have a lot of procedures that we can do to improve under eye bags, but obviously surgical intervention with a oculoplastics may be the ultimate solution. But I think we can definitely devote more minutes talking about the invasive procedures on another day.
Of course. Well, several options, certainly. So that's
A
a
lot
nice
of options, yes.
Yes, we like this.
Want a research
And
option as well, a research-based one, a little factoid?
yes, please.
So the we just published some work where we showed that a substance that you all have heard about, melatonin, um, if you have sleep disorders, jet lag, you take melatonin. Well, if you administer this in the laboratory, in the incubator, to eyelid skin, to fairly aged eyelid skin, and you topically administer melatonin in a high dose, you can actually improve aging parameters. So melatonin gets me a lot more excited than vitamin C, I have to say, because it's the wonder anti-aging hormone, and it zooms right into the places of the cells where all these free radicals are being made into the mitochondria. And it not only then grabs those and neutralizes them, it also promotes the expression and activity of enzymes that take care of free radicals. And in addition, it helps to repair DNA damage. So all these things, if they really work in your face, in your eyelid skin, around your eyes, that hasn't been clinically tested yet. So if that can be transferred from what we have seen in the lab, if that really works on living human beings, I would grab melatonin right there.
Right. Dr. Powell's raised a very good point, but also want to caution audience. A lot of times what we learn in the laboratory setting may not translate because a lot of times when we use products on real people, we need to talk about penetration. Is a particle large or small enough to penetrate through your epidermis? We need to talk about bioavailability, how much bioavailability is there after it goes through your skin. And then lastly, we need to talk about tolerability. So, you know, does your skin react to it? Does it irritate your skin? This is why topical skincare, cosmeceutical is such a huge industry, because there's a lot of pseudoscience, and there's also a lot of hurdles, or I would say barriers, to have something that really works and safe.
Excellent points. Thank you.
And we've talked about what works and what doesn't, or what we need to wait on so far. In respect to a cancer survivor, if they're looking for recommendations for growing hair after cancer during chemo, Dr. Paus, do you have any recommendations in that respect?
Yeah, well, if the damage has already been done and the damaging event is long over, then the question is how much lasting damage has been done to the stem cells of your hair follicles, because you need intact stem cells in order to be able to regenerate hair. If these stem cells have already been damaged, we don't have a good medicine available yet that can replace or fundamentally repair severely damaged stem cells. So the real critical issue is to avoid that this damage happens. And so during the period when you have chemotherapy, that's when the damage protection should become active. So cold cabs are a well documented way of doing that. If the damage has already been done, we are still searching for drugs that can help these surviving stem cells to produce new daughter cells and to revitalize the hair follicle again. But the research is not quite there yet.
And I'd like to open this question to the group. When we talk about plaque psoriasis, how is it best treated?
So I'll start on this one. So, obviously, again, plaque psoriasis is an inflammatory disorder of the immune system, and so genetically speaking, it's something that you have and then kind of appears at some point in your life due to some trauma. But we do know that it is a chronic condition, and so we do not yet have anything that is considered a cure. That being said, we now live in an era where we have a magnitude of amazing treatments, both topical treatments and systemic treatments to treat the disease. But it's important for the audience who have psoriasis to know that it is not just a skin condition. There are about a third of cases, perhaps a little bit more than that, that can have inflammation of the joints. And this could be anywhere from the spine, it could be in the hands and feet, it could be just in the nails and the fingers. But that being said, treatment varies when that happens because this is a destructive type of joint inflammation. And then in addition to those two things, there is a well-documented cardiovascular risk, which is, heart disease that comes with it. Things such as metabolic syndrome, where you can build an insulin resistance and diabetes and so on. And so I think that the most important thing is to know where you stand in the spectrum of psoriasis severity and then discuss treatments from there on. But the main treatments are all kind of geared at quainting the inflammatory cascade that is involved in causing psoriasis. And so there are many agents, both systemic and topical, that can achieve that. But what is best for you depends on many factors that is too difficult to just generalize. But I can tell you that there is absolutely light at the end of the tunnel for psoriasis patients in today's world. So seeing a psoriasis expert dermatologist is a very important thing.
And this next question is around a drug, astaxanthin. And does it help protect against the sun? Dr. Hu?
No, there's no evidence on that. The only nutraceutical, well, actually there are a couple, but the best one with evidence at boosting your natural defense against the sun will be something called it's in HelioCare, polypodium locotomus. That's a long word for basically active ingredient derived from a fern from that grows in South America, Central America. So it's a natural plant antioxidant, can boost your natural SPF by about 4, and multiple studies have shown that it's safe and effective in protecting your skin against UVA, visible light, and UVB damage. A lot of times we recommend it for people who have pigmentary disorders, vitiligo, melasma, history of multiple skin cancers, or have had a lot of immunosuppressive therapy. The second nutraceutical with evidence at kind of boosting your skin's against development of potential skin cancer will be nicotinamide, which is, again, studied in large clinical trials, even though one of the latest clinical trials did not find significant improvement, but there's some criticism of that trial too complicated to go into, but we still recommend that to our transplant patients overall as dermatologists treating high-risk patients. So the answer is no, but there are other better options.
I have just to add to that, and I have no conflict of interest, but I wholeheartedly agree that those are the two main ones that we talk about. But there is some new evidence, again, small level studies that have come out regarding the nicotinamide. And so if you are a patient who has extensive cardiovascular disease, you should absolutely speak with your doctor before starting that. But that being said, HelioCare comes in two forms from the company that developed it: the simple form and in the form that already has that B3 within. So I think that's a very good point made.
And Dr. Dorisas, red light therapy, is it good, bad, or are we still waiting on that one too?
It's a good question. So, I mean, the real question is it good or bad for what? But let's assume we're staying in the anti-aging realm. And so, we use red light therapy in offices as well. I think the real question is the device that you're using for your red light therapy, what energy level can it achieve in terms of its power? And I think that's an important distinction because, for example, for hair growth and kind of inflammatory acquaintance of hair inflammation, we talk about red light therapy or low level laser therapy. The thing about it is there's a big difference with the lasers you can use or the lasers you can use in the office versus the ones you can buy for home. It doesn't mean that they're not effective, but you have to really kind of judge based on a budget. If it really is too cheap to be true, it probably is not true. That being said, red light therapy is still considered safe and useful for certain conditions. We now use it for anti-aging. There's a growing element of research happening in acne treatments. And so there's not a distinction yet defined between in-office and home devices. I think in-office is still the way to go, but it is safe. I think when we think of LED light emissions and kind of visible light, when we think about damage, I think there's more to be said about the disadvantages of blue light when it comes to aging and perhaps skin cancer as opposed to the red light.
And final question for this evening is about cellulite. Can it be reversed?
We can definitely improve the appearance of cellulite by treating the pocketing by breaking down the bands, and also treating the loss of collagen by filling it in through biostimulator, for sure. But keep in mind, definitely these procedures are costly and requires commitment. Usually 3 sessions are required. So yes, there's hope, but it's definitely not a quick fix.
Dr. Dorisas, do you have a final thought on that? I see you.
So, I mean, cellulite is another holy grail that we're trying to figure out. It's a question commonly asked. I think it all depends on your type of cellulite because Dr. Hu mentioned that there's pockets of fats and then there's collagen involved that creates these septal bands. And so it's really a multi-pronged approach. One is to texturally fill areas, and the other is to loosen kind of these structure points where you have this tension. So it's called subcision, and there's devices for that as well. But I think that's when you're looking to treat cellulite, the simple answer is you have to go to a well-established large office, because there is no one answer for all, and the answer is almost indefinitely never going to be a cream.
And one last question that we're sneaking in this evening. What do you see for the future evolution of aging products, treatments, and research? How will we reduce the signs and even reverse skin aging in the next 10 to 20 years?
I'm just going to throw in my 2 cents. I think the future is more moving into bioregenerative therapies that are not just replacing, but also helps our body to regenerate collagen, elastin, and fat. All three components are essential for aging. Obviously, lifestyle changes. We're talking about more of the interventional, like, medications such as semaglutide help people to lose weight, but also improve cardiovascular parameters. So similar therapies coming to also in the realm of anti-aging and rejuvenation. So definitely stay hopeful, but work on sunscreen first.
Thank you. I love hopeful. And of course, thank you all for participating in tonight's In the Know Town Hall. What an incredible and insightful evening. At UHealth and the Miller School of Medicine, we do all we can to provide excellent care and advance the kind of breakthrough research that responds to the needs of our patients. What you heard tonight reflects the innovation, the passion, and the commitment that is at the core of our collective mission to prevent and to cure age-related skin disorders. Your generosity ensures that we continue to push on groundbreaking research, deliver the best treatment options, and support outstanding physician scientists. Please remember that a full recording of this program will be posted online. I know I'll be going back to that. Look for the link in the coming days. In the moment, you will see a survey about tonight's town hall on your screen. Please take a minute to submit your feedback. And as always, we wish you and your family good health. Have a great night.